practice hand hygiene before I enter the patient's room. Okay, then I would knock.
Come in.
Hi, Mr. Bear. My name is Veronica. I'm going to be your nurse for today.
Okay.
I'm going to be changing your central line dressing. But before I do that, can you just verify your name and date of birth for me?
John Bear, October 16th, 1981.
Thank you. Okay, so this is just a simple procedure where I will be removing your soil dressing and I'll clean the area and then replace it with new dressing. And we just do this in order to prevent infection. Okay?
Okay.
All right, thank you. So I'm just going to go and grab all my supplies and then I'll be right back in.
Okay.
Okay, so now I would go out, I would get everything that I need. I would come back in. Okay, Mr. Bear, I'm back. Clean my hands again. All right, so we're going to start now. I would start the procedure by donning non-sterile gloves, which would be easier to put on if they were just fresh out the container. And then I've grabbed a mask while I was out for my patient because he's not able to turn his head. So I want to make sure if the patient's not able to turn their head, I put a mask on them to keep the area from being contaminated. Okay, and then I would only open my case enough to grab my mask. Okay, so then I'm going to put my bag out so I can have somewhere to throw my soiled dressing. So then I would start by removing the old dressing. Okay, makes me hurt a little bit. I'll make sure I'm holding on to the central line so that it doesn't pull out or it doesn't. Okay, so the central line will have markings that tell me how far in it should be, so that way if I do make a mistake and pull it out, I can try to like push it back in. But I would be making sure that I'm holding on to the line as I take off the tape. Once I get the tape off, I would then start to inspect the surrounding area for any signs of infection, such as erythema, any type of swelling, any pain with palpation, any drainage, or even if it was warm to touch. So everything looks fine. So at that point, I would remove the soiled gloves, discard those. I would clean my hands again. And then I would set up my sterile field. Okay, so I would don my sterile gloves, and then I would take out all of my supplies. Get them all set up. Okay, so this would be my the hand that I would use to hold on to everything, because this is my dominant hand. So this is the hand that I'm going to work with. So I would place my hand back on the CVAD, and I would break this, and then I would start to clean the area surrounding the line vigorously for at least 30 seconds. Then I would let that dry, and then I would scrub each line. Okay, then I would let it dry, and then I would place the dressing underneath, holding on to it, and then I would apply my Tegaderm. But I would be making sure that I'm holding on to my line, because I don't want to pull this line out at all. So now I would reapply the new dressing. And then be done. So then I would just apply my Tegaderm, and then I would be done. So then I would clean up all my supplies, and I would discard them. Take off my mask, take off my patient's mask. I would just check on my patient, just make sure is everything okay? Do you feel any pain, anything?
No pain at all.
Okay, great. And then I would give the patient their call bell, lower the bed back down to the appropriate height, and I would be done.